Hello, I'm Katie Breheny and I'm an NIHR School for Public Health Research Post-doctoral Launching Fellow. I'm based at the University of Bristol in Health Economics Bristol and the Centre for Public Health. For my presentation today, instead of focusing on one project, I'm going to give an overview of the different projects I have been involved in and what including a health economist can add to them. One project I've been involved in is the evaluation of the digital health contact, which is part of the FES scheme. The team have been interviewing school staff, school nurses and commissioners to understand their views on delivering an online assessment tool to identify health and wellbeing issues in secondary school children. I have reviewed these transcripts from a health economics perspective to understand what the opportunity costs are, whether they feel it is a good use of time, and the decision making surrounding its commissioning. I also supervised an NIHR intern over the summer. She has helped with the scoping review, examining the use of health and wellbeing screening tools in schools. The FES project has enabled me to network and collaborate with academics and practitioners in Leicester and Sheffield, and use qualitative health economics methods in a real-world evaluation. I'm also involved in a FIRST project, which is a collaboration between Bristol University and Hammersmith and Fulham Local Authority. The project is evaluating a pilot of providing universal free school meals in secondary schools. This is interesting, as they would like to understand whether the scheme provides value for money. The analysis that health economists would typically conduct to determine value for money does not align with what the local authority are anticipating, and the data available will not allow a typical economic evaluation. Using qualitative methods, the team are exploring what they deem to be value for money. For example, what the outcome would be and what the costs of the provision might be, beyond additional meals. I will try and determine the cost of the project using a pragmatic approach and the data available. Like the DHC, this project shows the value of including both qualitative and quantitative methods to answer economic questions. Finally, I have also been involved in the equity and efficiency cross-cutting theme. I've been working with other health economists across the SPHR on developing guidance on measuring efficiency in economic evaluation of public health interventions. We conducted a virtual workshop with a large number of expert health economists to understand the current methods and ways forward for developing guidance that could be used in practice. This has been a valuable opportunity to network with other academics and to learn about the cutting-edge research going on in this underserved area. Thank you for listening, and this is my email address if you would like to get in contact.